Welcome to your medical unit huddle for February 14th. I'm Ricky, your nurse manager. Kind of sad right now because I only re-record these like a couple dozen times and my tripod broke, so I'm gonna have to order a new one on the Amazon. So I'm sorry, I couldn't really find anything to balance this on, so I'm doing it by hand. As you can see, my strong arm. Okay, I am going to give a shout out to Hannah Camerzell for winning the Wall of Fame and to Whitney Galloway for being a nominee. So if you see those gals, give them a congratulations and a high five. We also had Nick and Sarah Patrick who won the Celebrating You Award. You might recall a couple months ago they did a little something special for one of our patients here in the hospital. We have 3 people joining our team. We have Sydney, who is a full-time day shift nurse. We have Jacqueline, who is a full-time night shift new grad nurse. And then we have Joe, who is a part-time night PCT. So if you see those 3 folks, welcome them to our medical unit team and let them know how amazing we are here. All right. Down to a couple of housekeeping items here. Just a reminder that one, you guys are doing an amazing job getting patients on Visi, but just remember it takes a village. It definitely is the PCTs who are typically applying the device, but nurses, we still need your support in ensuring that our patients are on a Visi device. If anyone has any troubles or difficulties with putting a patient on a Visi device because they're really not sure how to use the device, like the functionality, please let me know and we can get you reoriented to that. I might have to join you. Okay, niche education, fall education is due on the 28th, so please make sure that you guys have that done. And check out the quality board in the report room. Josh and Melissa have been updating that for us. You will see that we are doing a phenomenal job with our quality indicators because you guys are amazing and I can't thank you enough. All right, Carly's takeaways from our RLs. You know that we meet every week and we discuss all of our RLs and we look for trends and that kind of thing. So just a couple things come up. Just make sure that when you guys are completing the admission navigator that you guys are completing the stop bang assessment for obstructive sleep apnea. If that patient scores a 5 or higher, you will be given a BPA, and basically just to remind you that the patient needs to be on continuous pulse ox for 48 hours. If you have any questions about that, I think the educators also sent out emails on that as well. If you have a patient who is on palliative care and they do have a change in condition, you can still call an RT. I think people are confused that if a patient is palliative care that means comfort care, and that's not necessarily true. So please make sure that if you guys have a patient changing condition and they're palliative care or they're a DNR, you still can call the C-Corps for support. Just because they're one of those things or they're both of those, palliative care and DNR, that doesn't mean that we don't treat. And then remember that also the RT, they have 10 minutes to respond. So if you have a patient that you really are concerned about, they have agonal breathing, they have a thready pulse, they're unresponsive or anything like that, call the code. Don't wait for the C-Corps, because the C-Corps nurses, they really do have that 10-minute grace period that they might be finishing up with another patient, another RT. And so if that's the case, then they have to, and I say they like the ICUs who staff these people for us, they have to try to coordinate getting someone else to us. So again, if it's something that you're like, ugh, I really need someone up here right away, you can call the code, of course, when in doubt. All right, that is all I have. I always encourage you guys to subscribe to our MCR Medical Unit YouTube channel, and I hope you guys have a great shift.